For the adult physical assessment, I already performed hand hygiene and personal protective equipment because hand hygiene is the most effective way to help prevent microorganisms, and personal protective equipment is based on transmission precaution. It is required. And next is, ma'am, my name is Robby Meo de Villas and I will be your nurse today. Because it is essential to foster therapeutic nurse relationship based on mutual trust and respect. May I know your name, ma'am?
My name is Ruela.
Can you tell me your birthday?
My birthday is on October 24.
Because this is to ensure that I'm in the right patient that receives the right intervention and help prevents errors. Ma'am, I will be doing a physical examination. Ma'am, I will be doing an adult physical assessment to determine your heart, neck, vessels, your peripheral pulses, breast, axilla, abdomen, and musculoskeletal. The assessment also gives you a chance to talk to me about any ongoing pain or symptoms that you may experience or any other health concerns that you might have. Do you have any questions before I proceed?
None.
Okay, thank you very much. Then I will close the door and or curtains around your bed to ensure your privacy. Check all the materials that all needed. Gloves, stethoscope, clip, reflex hammer, cotton ball, hot and cold object. First, I'm going to assess the heart and neck vessels of my client. I'm going to inspect and palpate the pericardium of my client. Ma'am, I'm going to place my hands in your chest. Would that be okay?
Yes.
Okay, thank you. Now I'm going to place a diaphragm in your chest. But first, I'm going to clean this. But would that be okay if I place it inside your shirt so that I can hear your heartbeat clearly? Yes. Okay, thank you. This is the aortic area, the second right intercostal space. And this is the pulmonic, the second left intercostal space. The Erbis point, which is the third left intercostal space. And the tricuspid area, the fourth left intercostal space. And lastly, the mitral area or apex, the fifth intercostal space. Okay, thank you, ma'am. Now I'm going to assess your neck vessels. I'm going to palpate each of your carotid artery. Would that be okay? Okay, thank you. Okay, now I'm gonna use my stethoscope. Ma'am, please exhale and hold your breath for a few heartbeats so respiratory sounds will not interfere. Would that be okay, ma'am? Okay, let's start. Exhale. And then hold. Okay. another. Exhale and then hold. Okay, thank you. Lastly, I'm going to palpate your peripheral pulses. Harap po kayo, ma'am. Okay, thank you. First is the temporal, the carotid pulse, and then, ma'am, pakitaas po yung kamay. Okay, thank you. Your brachial pulse, and then your radial pulse, okay. Ma'am, tayo po kayo. Okay. Ma'am, pwede ko po ba ipasok ang aking kamay?
Yes.
Okay, thank you. Your femoral artery. Okay, ma'am, tayo na po kayo. Ay, upo na po kayo. Next is the popliteal pulse. And then next is the dorsalis pedis pulse. And lastly, the posterior tibial pulse. Okay, thank you. Upon inspection, there is no strong pulsation. When I palpate the precordium part, I feel slight pulsation, and when I auscultate the four anatomic sites, which is the aortic, pulmonic, and tricuspid, and mitral, I heard it clearly. And upon palpating the carotid pulse and different peripheral pulses, it is all symmetric pulse. It is all symmetric when it comes to volume, and it is full in pulsation. The quality remains same when the client breathes. Now, I'm going to assess the breast and axilla of my client. Just to continue the physical assessment, I will be assessing the breast and axilla. Is it okay for you to stand up, ma'am?
Yes. Okay.
And then, just do what I'm going to do. Ma'am, harap po kayo rito. Okay. Just do what I'm going to do. Would that be okay?
Yes.
Okay, thank you. Now, your arms on the side. Raise your hands. And then, your arms press against your hips. And lean forward. Now, you will do that alone while I'm going to assess you. Okay?
Okay.
Okay? Your arms on the side. Raise your hands. Your arm press against your hips. And then, lean forward. Okay, thank you. Ma'am, I will going to put the pillow under your back. Urong lang po kayo ng konti. Thank you. And then, ma'am, taas nyo po yung kamay nyo. Ayan. I'm gonna palpate your breast. Would that be okay?
Okay.
Okay, thank you. This is the vertical strip. And then, this is concentric. May masakit po ba? And lastly, this is the hands of a clock. Okay, ma'am. Thank you very much. Upon inspection and palpation of the breast of my client, I asked her to place the arms on the side over her head and then press against the hips and lean forward. Upon seeing it, I was able to assess my client's breast that is asymmetrical. The color of it is within normal racial tone. It is round in shape. The nipple is everted. There are no dimpling, puckering, or bulging of the skin. Upon inspection of areola, it is round. The color is pink. There are no irregular sebaceous glands on the surface of areola. There are no discharge as well coming out from the nipples. I use the three methods when I palpate my client, which is the vertical strip, the concentric, and then the hands of the clock. For vertical strip, I start it with the tail of the spans going up, downward. For the centric, it starts with the tail of spans and then going down on the nipple area. Then lastly, for hands of a clock, I start it with the 12 o'clock, then so on. And upon palpating it, I include the axillary lymph nodes. There are no lymph nodes palpated. I will be now inspecting the color of the skin. It is normal racial tone, no blemish skin. There are no appearance of soluble white stray or surgical scars found on the abdomen part of the client. It is a little bit convex of appearance. It is symmetrical in contour. There are no evidence of enlargement of liver or spleen. Now I'm going to auscultate the abdomen for bowel sounds, brutes, and friction rub. But first, I'm going to clean the earpieces. And the diaphragm of my stethoscope. Okay. This one. left upper quadrant. Next is the right upper quadrant. Then lastly, the right lower quadrant. Okay. But let me first clean it. Okay, upon auscultation, the abdomen of my client, using the diaphragm of my stethoscope, it is audible, having 16 burburrhythmic sound per minute, and I do not hear any bruits and friction rub. Now I'm going to percuss your abdomen, ma'am. Okay, the left lower, upper, and right lower quadrants are all tympanic, while the right upper is dullness upon percussion. Now I'm going to palpate your abdomen. Ma'am, sabihin niyo lang po sa akin kung may nararamdaman kayong masakit. May masakit po ba?
Wala po.
Is there any tenderness po?
Wala po, nurse.
Dito po.
Wala po, nurse.
Dito po.
Wala
palpate the liver of my client. A while ago, I will now proceed to the deep palpation since there is no tenderness reported by my client a while ago. Ma'am, hinga lang po kayo ng malalim. And as you breathe, please hold as I'm going to deep palpation. Would that be okay po? Okay, thank you po. May masakit po ba? Okay po. I will now palpate the spleen of my client. Is there any tenderness po? Okay. I'm now going to palpate the kidney of my client. Ma'am, sabihin nyo lang po ulit sa akin kung may masakit. May masakit po ba? Okay. Dito po. Okay, thank you po. Lastly, I will palpate ko po yung pantog nyo. Sabihin nyo po sa akin kung may masakit. Okay lang po ba yun? Okay. May masakit po ba? Dito po. Okay, thank you po. Now, upon palpation of the 4 different quadrants, there is no tenderness reported by the client. The liver, spleen, kidneys, and bladder are not on the Upon palpation of the 4 different quadrants, there is no tenderness reported by the client. The liver, spleen, kidneys, and bladder on the specific location of the vital organs. Upon palpation of different quadrants, there is no tenderness reported by the client on the specific location of the vital organs. The liver, spleen, kidneys, and bladders are palpated. I'm now going to assess the musculoskeletal of my client. I am now inspecting the muscles on the arms and legs. Now, ma'am, please stand up because I will palpate your muscles. But first, I will inspect your muscles and then palpate it. Okay. Dito naman po. Okay. Now, ma'am, you may now sit down. I'm going to palpate your bones. Ma'am, pwede po mapakita sa inyo kamay, braso. Okay, thank you. Do you feel any tenderness po?
No.
Okay, ma'am, move ko lang po yung braso nyo. Now, my client, I don't hear any crepitus. Okay, on the other side. Do you feel any tenderness po?
No.
Okay. Thank you. Now, I will be looking at your knees because I will now palpate the joints for swelling and tenderness. Now, I will be looking at your knees because I will now palpate the joints for swelling and tenderness. Don't move please, ma'am. Pakisabi po sa akin if may tenderness po ba.
Wala po.
Okay. On the other side.
Wala po.
Okay, thank you po. Lastly, I will now assess the joint range of motion. Please imitate what I'm going to do po. Okay, ito po. May nararamdaman po ba kayo masakit?
Wala po.
Dito po sa kabila.
Wala po.
Okay, dito po.
Wala po.
Ito naman po.
Wala po.
On the other side.
Wala po.
Lastly.
Wala po.
Okay, next is the lower part. Ma'am, please stand up po. Just imitate what I'm going to do. On the left leg, forward, then back on the other side, forward, back on the other side. Okay, ma'am, kayo naman po. Forward, back on the other side, forward, back on the other side. May nararamdaman po ba na masakit or limited po na galaw?
Wala po.
Okay, thank you po. Upon inspection, the muscles are both symmetric. There is no muscle atrophy seen on the muscles of my client, and upon palpation of the bone, it is intact. The joints are not swelling. There are no joints when she moved. The synovial fluid is not inflamed. The client reported that there is no tenderness. Upon palpation in the muscle, joints, bones, as well as she was able to do the range of motion actively. No report of limited movements and tenderness upon movements. Next, I will be assessing the motor function of my client. Ma'am, I want you to do is to walk and do several things while standing up. Would that be okay?
Yes.
Okay, thank you po. Now, ma'am, lakad po kayo ng 5 steps forward. And then, turn around 5 steps backward. Okay
Okay.
po.
1, 2, 3, 4, 5.
Turn around.
1, 2, 3, 4, 5.
Okay, thank you po. Next is the Romberg test. I want you to do is to close your eyes for 20 seconds, your feet all together, hands on the side. And if you feel that you're a bit swaying, I will support your back po, don't worry. Ma'am, dito po kayo sa harap. Okay?
Just tell me to start.
Yes. Start now. Okay, thank you po. Next, raise your foot up while balancing, then close your eyes in 20 seconds. I'm just here to guide you po. Okay, on the other foot naman po. Close your eyes. Okay, thank you po, ma'am. The heel-toe walking. Can you do 5 steps forward, then backward? Okay, kayo naman po.
How many steps again?
5 steps forward.
Okay.
1, 2, 3, 4, 5. Then turn around. 5 steps backward.
1, 2, 3, 4, 5.
Okay, thank you po. Lastly is the toe or heel walking. Ganito po. So that I can see if you can still balance in 5 steps forward then backward. Okay, kayo naman po. One, two, three, 4, 5. Okay, thank you po, ma'am. For the motor function and balance test, my client was able to perform walking gait without any problem. She was able to walk with ease. Her posture is erect and her gait is smooth. For Romberg test, the client has a negative result, meaning she sway a little bit but not able to fall down. And for the standing in one foot with eyes closed, the client was able to maintain her balance. And aside from that, the heel-toe walking, the client was able to walk in straight pattern and turn around, and she was able to walk in straight pattern. Also for toe walking, she was able to walk with ease and then balance. Now I will be assessing the fine motor of my client. Ma'am, you have to place your finger on your nose, and I will also place my finger on my nose, and you just have to point your finger where I point my finger, and you need to point it thoroughly.
Okay.
We will be doing this on maximum of 6 different directions. Would that be okay po?
Okay.
Okay, thank you po. Okay. Next, finger to nose and to nurse finger. Now, I won't be putting my finger on my nose. Rather, your finger should be point on your nose on different directions, and it is a little bit faster than before. Understood po ba?
Yes.
Okay, thank you po. Okay, thank you po. Out of 6 directions, the client was able to point 6/6. It means she has a fine motor. Next. Now, ma'am, next fingers to fingers. Ma'am, just imitate my hand. Then try to open your fingers one by one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay po ba? Okay, kayo naman po. 6, 7, 8, 9, 10. Okay, thank you. Now, next, fingers to thumb, just like before, but like this. Yes po. Ayan. Okay? Kayo naman po gumawa. On the other hand naman po. Okay, thank you po. For fingers to fingers and fingers to thumb, the client was able to do the 5 movements of her fingers. Next, alternating supination and pronation of hands. Parehas tayo naka-supine and prone position on hands, and I will be changing the position like this. Mabagal muna at mabilis. After few seconds. Okay, thank you po. Next, heel down, opposite shin. Itaas nyo lang ang legs nyo going down. Ayan, ganyan po. Okay, thank you po. Next, Please point my fingers while sitting down with your toes. Okay, thank you po. Okay, at other toes, other legs po. Ayan. Okay, thank you po. For alternating supination, the client was able to follow the alternation movements. And next, the heel down opposite shin, she was able to place her heel of her foot going down to the shin properly. It means there are no jerky movements or tremors observed. Lastly, the toe or ball of the foot to the nurse finger. The client was able to touch my finger while on different directions. I will be now assessing the sensory function of my client. Ma'am, throughout the procedure, you have to close your eyes, then identify things and say if you feel it or not. For the light sensation, I will be using a cotton ball and then point out where did you feel the light touch. Okay, ma'am?
Okay.
Okay, thank you po. And for the pain sensation, I will be using a sharp part of this paper clip. You just tell me again where you feel the sharp sensation. Would that be okay?
Okay.
Okay, thank you po. Okay, thank you po. Now, I will now hold your hand and tell me if the position is up or down into your fingers. Would that be okay po?
Okay.
Okay.
Up. Down. Up. Down. Up. Down. Down. Up. Up. Down.
Okay, and the other hand naman po.
Up. Down. Down. Up. Up. Down. Up. Down. Down. Up.
Okay, thank you po. Next is the tactile discrimination. I will be using again the paper clip and the sharp tool. If it is 1 point or 2 point, just tell me po. Okay?
1 point. 2 point. 1 point. 2 point. 1 point. 2 point. 1 point. 1 point. 1 point. 1 point. 1 point. 1 point.
Okay, thank you po. For stereognosis, I will draw a number on your palm and other palm. Just tell me what number it is.
Okay.
In your palm area.
8.
Okay, thank you po.
7. 6.
Okay, thank you po. Next is the extinction phenomenon. Please raise your arm po forward. Then tell me if you feel both arms with this left side or right side only.
Okay.
Okay po.
Right side. Both. Left side. Right side. Left side. right side, left side,
Both. Okay, thank you po. Lastly, the temperature sensation. Tell me if it is cold object or hot object. Okay po ba?
okay,
Just close your eyes. Cold, cold, hot, hot. Okay, thank you po. For the light touch, the client was able to identify or point which part was the light sensation. Then for pain sensation, she was able to identify which part of her arm I placed the paper clip having the sharp area. Next position or kinesthetic sensation, the client was able to identify if it is upward or downward. Next is the tactile discrimination. She was able to identify if the paper clip was 1 point or 2 points only. For stereognosis, the client was able to identify what number I drew on her palm, both left and right. For extinction phenomenon, the client was able to identify if both hands touches the cotton on her arms or only one side. Then lastly, for temperature, the client was able to identify if it is hot or cold temperature. Now I'm going to assess the reflexes of my client. First, I'm going to use reflex hammer. This will not hurt you. This is just a rubber, ma'am. And I will now elicit your reflexes. First is your biceps reflex. While resting your arm, ma'am, I will just place my thumb and strike at narrow part of this reflex hammer. And I will just observe your hand if it is going to move. Okay. My client moves her finger. It means it is positive or biceps reflex are present. Next, I will be doing the brachioradialis reflex. Itataas ko lamang po ang inyong kamay. And I need to observe your thumb area if it is will move. Okay po ba?
okay,
Okay. Her finger is moved, that means her brachioradialis is present. For triceps reflex, just rest your arm. And then, I will be striking this part for me to identify if it is going to move your hand left, kamay your left and right. Okay, thank you po. Ayan. My client move her hand sideways. It means triceps reflex is present. The patellar reflex, ma'am, please make sure your feet should not touch the floor. And then, can you sway your legs po? Okay, thank you po. Another. Okay. Another one. Ayan. The client patellar reflex is present. Next is the Achilles reflex. Ma'am, pwede po ba pakitaas yung isa niyong paa? Your one leg should be dangling. Kindly move your feet po. Kindly move your feet. Okay, thank you po. Okay. Now, lastly, the plantar or Babinski reflex. Okay, the Achilles reflex is present also. the plantar or Babinski reflex, I will be doing the inverted J on your foot. The plantar reflex is absent. Genitals. For female genitalia of my client, the pubic hair is inverse triangle. She is now on stage 5. The labia minora and the labia majora are properly aligned to each other, and the clitoris on the top of the urethra opening, it is pink and not swollen, and the urethral orifice is patent. It is not inflamed. The vaginal orifice is externally, it is not swelling, and there is no visible laceration, and upon inspection of the cervix, it is pink in color, both intact using vaginal speculum, and the client did not feel any tenderness upon entry of the vaginal speculum. For the male genitals, the pubic hair is triangular. It is dispersed on thigh of the client, and upon checking the genitalia of the client, it is on the 5th stage using Tanner's grading, and for the penis, it is circumcised, and the urethral meatus is on the tip of the anus, Allen's penis, and upon palpation of the penis and scrotum, it is not tender. Lastly, the rectus anus. Upon inspection of the anus of my client and surrounding tissue, it is colored deep brown, and there are no lesions seen surrounding the area. And upon palpation of the rectum area while in the same position, the muscle tone is present, and the muscle surrounding anus sphincter is intact, and there are no nodules and masses, and the client reported that there are no tenderness. For the evaluation, I already documented the findings and recorded findings using the EMR. I also gave the follow-up examination for my client and referred her to the specialist for the deviated result that I documented. Again, my name is Robby Melody Villas, and thank you very much.